Alright, I'm gonna put this in presentation mode. My name is Addison Myers, and I did my presentation on what it takes to be a nurse. Down in the right-hand corner, the picture is the nursing symbol, and up in the right-hand corner, we have an injection. Alright, nursing. Nursing is a profession or practice of providing care for the sick and infirm. It started in the mid-19th century, and it's an ever-changing profession, which means from day to day, things are constantly changing, like right now with COVID. How far away people have to stay, if you have to wear masks, what kinds of masks we have to wear, everything like that. And nursing is something that will always be needed. We'll always need nurses to help our doctors, to take care of the sick. It's something that no matter how it changes or what advancements we get, we will always need a nurse. Nurses need to be, so my thesis, I put nurses need to be compassionate, quick to adapt to change, and advocates for the patient. Compassion is super important with nursing. It builds that bond between your patient, and you need to be able to adapt because things change on the daily basis. Like right now with the pandemic, you never know what's going to happen, and the quicker you are to adapt, the easier life is going to be. And advocates for their patient, when you're advocating for your patient, you're going to build that trust, but someone also needs to be able to speak up for them and help them, because sometimes your patient won't speak up and they need their nurse to help speak up for what they need. Okay, so compassion. And so compassion is defined as the sympathetic pity and concern for sufferings or misfortunes of others. And like I said before, it allows nurses and patients to make that connection. It allows your patient to trust that nurse more, and overall it makes that patient feel comfortable and welcome. And, that's a big part. You want your patient to feel comfortable. And then I put this little quote over on the side. It says, "No act of kindness, no matter how small, is ever wasted." I thought that was something just really nice that fit with compassion, because, compassion is an act of kindness. And even something little you might not think will matter, it matters to your patient, and they see those things. Okay, adapting to situations. As a nurse, you should be able to adapt to anything thrown your way. I mentioned this again earlier. This increases the chance of fixing and finding the problem. And, the profession is ever changing. Like, we used to paper chart, and now everything is all computer. That was a big change, going from paper to all electronic. But we have to make sure we adjust to those things. Some things are out of our control. We just have to be able to adjust to them. Okay, and my last part of my thesis is advocating for a patient, and a person who helps to guide a patient through the healthcare system. This includes helping going through the screening, diagnosis, treatment, and follow-up of a medical condition such as cancer or diabetes. Doctors come in and out, and they see a lot of patients, and sometimes a patient might be confused about what that doctor's saying, so they can ask the nurse, "Hey, can you clarify for me what they said?" Or, "What does this mean?" Or, "What's something else I could do to help myself get better?" And just talk to that patient, clarify with them, make sure they know everything they need to, go over everything that was said. That's a big part of advocating for your patient. Okay, where it all began. Florence Nightingale. She acted as a nurse during the Crimean War. She adapted to change and worked with what she had. She did not have hardly any supplies, not even basic things such as band-aids, bandages. She literally had nothing, but she made it work. And she improved the sanitation in the hospital where she worked. She had patients helping scrub the floors if they were able to, scrubbing the walls, getting their sanitary conditions back up to where they should be. Because, when things aren't sanitary, that spreads infection, and that makes people worse. She saved hundreds of lives. She improved her hospital conditions. She lowered death rates by 2/3 in the hospital where she worked. And she forever changed the face of nursing. When we think about nursing, we think about Florence Nightingale and how she basically started it. She was one of the first female nurses. She paved the way for everybody else. And advocating for her patients was Dorothy Dix. She was a major advocate for patients, but especially for prisoners and mental health patients. She volunteered at a local prison, and she left her teaching career of 24 years at the age of 39 when she saw how bad these prisoners and the mentally ill were being treated. They were sitting around in their own waste. They weren't even treated as if they were human. It was awful, and she wanted to change that. She knew it wasn't right, so she went on to pursue that. She didn't even have a degree in nursing. At this time, modern nursing didn't exist. She went and she fought in many court battles, and after all the years of her advocating, she increased the number of hospitals from 13 to 23, which was a big breakthrough back then. And then this is a quote I put in my book. I felt it was especially important to mention it. I put in my essay, I thought it was especially important to mention it in my presentation because it's a big part. And it was by Judith Shelley and Arlene Miller, and they were both nurses. And they wrote, this was out of one of their books, and it says, "When we bathe another person, we cross the intimacy barrier. Something is shared. We get up close and personal with another human being. We enter his or her world. It is a humbling act for both the washer and the washee. It is an act of compassion. Too often, perhaps, we want to hurry through the bath so we can get on with the more important aspects of nursing. But perhaps it's the simple ritual of the bath that we can discover what it means to be a true nurse." Okay, in my conclusion, nursing is an ever-changing and always adapting career. It's something that isn't cut out for everybody. It takes a certain set of skills, Nurses need to be compassionate, able to adapt, and advocate for their patients. All three of these things help benefit the patient's well-being and overall care and help them to heal quicker. When you feel better and you feel like you're being taken care of, you're not going to worry as much, and when you don't worry, you heal faster. And, when you get the best care you need, if you have to come back someday, then you will. You're not going to be scared because of a bad experience. Nurses like Dorothy Dix and Florence Nightingale have forever changed the field of nursing. Without them, we wouldn't be where we are today in the medical field. Thank you. That's the end of my presentation.